It's difficult to know if you have sleep apnea, but there are a lot of indications that you do. Do you wake up feeling drowsy? Are you dreaming? If you're not dreaming, you're not getting into your REM sleep. That's a dead giveaway. If you don't dream or you rarely dream, absolutely. If your spouse or bed partner notices you stopping breathing at all or gasping for air, you've got sleep apnea. Another indication, great big indicator, is snoring. If you are a heavy snorer, you probably have sleep apnea. If you don't now, within 5 to 10 years, unfortunately, you will. Snoring is the partial blockage of the airway by the tongue. The tongue is falling back, partially blocking the airway a little bit, but not completely. Well, guess what happens when we get older? When we get older, we lose muscle tone. The tongue is made of all muscle. So as we lose muscle tone, the tongue is going to fall back further. As it falls back further, that snoring is going to increase, and eventually it's going to fall back all the way, blocking the airway completely. So you will go from mild snoring to moderate to loud to very loud snoring to mild sleep apnea, moderate to severe sleep apnea. Life insurance companies already are aware of this. If you have sleep apnea or a diagnosis of sleep apnea, most life insurance companies today will not give you life insurance. But here's a new one. I've had a number of patients that have come in that have told me, in fact I had a FedEx driver who was switching to UPS, or it might have been the other way around. To get the job, he had to go through a mandatory sleep study. He came back, the sleep study said he did not have sleep apnea, but he was a heavy snorer. Because he was a heavy snorer, he got the job as the driver, but they would not give him life insurance. Because the life insurance companies knew in 5 to 10 years, he would have sleep apnea, and they could not get rid of his life insurance. And if you have sleep apnea, you're at 4 times the risk of dying. And the life insurance companies don't want that risk. So that's something you're going to see much more of. But to get back to your initial question of how do you know, the only way to know for sure is we do an overnight sleep study, what's called a PSG or polysomnogram. You stay overnight at a center, kind of a cross between a hospital room and a hotel room. They'll hook up a bunch of wires, you stay overnight, they do what's called a sleep study, and that will give 100% diagnosis. There are also some units that you can use at home. It's called an unattended sleep study. Both of those will tell you 100% if you have sleep apnea or not. But the indicators are heavy snoring, as I said before, waking up with headaches, a bed partner realizing that you're stopping breathing, gasping for air, your lack of noticing that you're dreaming anymore. All those are indications. Also, one thing that you might notice, if you have any alcohol a few hours before you go to bed, your snoring will always be worse, as well as sleep apnea. Also, if you sleep on your back, it will always be worse. And again, the reason is alcohol is a muscle relaxant. You're relaxing the tongue, boom, it's got a greater chance of falling back further.